Hey everybody, this is the effect of low-level laser therapy on improving pain and range of motion in individuals with knee osteoarthritis. So our clinical scenario, osteoarthritis is a common problem in the middle-aged and elderly population. The knee joint is the most common joint affected with osteoarthritis. The disease can cause pain and loss of knee mobility and can have a detrimental effect on functional activities and activities of daily living of those suffering with the condition. If pain and functional limitation become extreme, a total knee arthroplasty may be needed. Non-invasive solutions are designed for controlling pain and function in patients with knee osteoarthritis in hopes that they do not need to go to the more extreme measure of a total knee arthroplasty. One potential solution to the problem is low-level laser therapy. So that comes to our clinical question. Do patients diagnosed with osteoarthritis who receive low-level laser treatment in addition to physical therapy show significant improvements in WOMAC measures of pain, stiffness, and function when compared to those that do not receive the same treatment? So a little bit about our search strategy. Here's our PICO question. So our patient and client group was individuals with knee osteoarthritis. Our intervention was low-level laser therapy. We compared the groups getting this intervention to physical therapy exercises without the low-level laser therapy. And outcome measure we used was the WOMAC scale. Sources of evidence searched, we used these major databases, the majority of which were found through the Ohio University Library database. So here's our inclusion and exclusion criteria. Our inclusion criteria were studies that investigated individuals with knee osteoarthritis that used low-level laser therapy. Also studies that used the WOMAC outcome measure to assess pain, stiffness, and function with level 2B evidence or higher from the past 10 years. Our exclusion criteria were if they used high-level laser therapy as compared to low-level laser therapy. If a study stated a significant difference, they had to have a p-value less than 0.05 to support it. We excluded treatments that combined NSAIDs or other medications, or if a study combined the low-level laser therapy with another modality. And lastly, if the study did not use the WOMAC as an outcome measure, it was excluded.
For our results of our search, there were 7 possible studies we identified. Only 3 of them met our inclusion criteria. 2 were randomized control trials, the Gomes and Yusuf articles, and 1 was a randomized cohort study, the IP article. And all 3 of them reported that low-level laser therapy had a significant effect on the WOMAC in at least one of the outcome measures. For the Gomes article, it was a randomized control trial with 3 groups, an exercise group, an exercise and low-level laser therapy group, and an exercise plus a placebo low-level laser therapy group. It showed a significant difference in the pain and function portion of the WOMAC as seen by the p-values, but there was no significant difference in the stiffness portion of the WOMAC. Its level of evidence was 1B with a validity score of 30. For the IP article, it was a randomized cohort study with 2 groups, an exercise and an exercise plus low-level laser therapy group. It produced a significant positive difference in the pain portion of the WOMAC, but not the stiffness portion of the WOMAC. And due to it being a randomized cohort, it was a 2B level of evidence at a validity score of 18. The Yusuf article was our other randomized control trial article. It also had 3 groups, a higher laser dose, a lower laser dose, which both were still low-level laser therapy, and then a control group. The exercise plus the low-level laser therapy produced a significant difference in the pain, stiffness, and function portion of the WOMAC outcome measure. It was a 1B level of evidence with a validity score of 23. For our discussion, the length of the results varied between our studies. The Gomes and Yusuf article only showed short-term improvements with 6 and 8 weeks, respectively, but the IP article showed long-term improvements with the modality going out to 6 years. So we believe more research must be done on the long-term effects of low-level laser therapy on knee osteoarthritis. And also, the use of article was the only one to show improvement in stiffness. So we believe more research must be done on the low-level laser therapy's effect on range of motion. We believe the topic should be revisited in about 3 years. Finally, our clinical bottom line. We believe that there is strong evidence to suggest that low-level laser therapy combined with therapeutic exercise can be an effective modality for treating knee osteoarthritis pain. And here are our references.